Hello, welcome to my channel. Today we will be going over exam 2 and this is part 4, questions and answers. I have a video out on exam 2, developmental theory, health, wellness and critical thinking. I have decided to do some question and answers for you to test yourself to see how much you know. My first question and answer from RN NCLEX examinations. Patient is on C. diff. What does a nurse do? Correct answer. You place this patient on contact isolation. And when you are doing your hand washing, what do? You'll wash your hand with running water. Even if you use a hand sanitizer, the correct answer is running water. Is an test question for patient with C. diff, running water. Patient is on contact isolation. What is normal urine output per hour? And the answer is 30 cc's an hour. Patient with a Foley catheter, example, your fresh post-op patient, 7-3 shift, 3 to 11 shift, 8 hours, that will be 240 cc of urine. Post-op patient, if you're not voiding 30 cc an hour, patient is at risk for developing abdominal distension, urinary retention. Patient is at risk for developing hemorrhage for patients who have had fresh post-op abdominal surgeries. Notify your doctor immediately. This is critical. My next question. Urine excreted daily for an adult should be, the correct answer is 500. The correct answer is 1500 cc's to 2000 milliliters a day. 1500 to 2000 milliliters a day for urine excreted daily for an adult. My next question, give examples of objective data. Objective data are your vital signs. Temperature, pulse, respiration, blood pressure, objective data, lab tests, x-ray, diagnostics, CT scans. These are all your objective data. Height, weight, wound appearance. These are objective data. What you see, measurable facts are objective data. Your patient say, I am in pain. That subjective data comes only from the patients. What is an example of a sublingual medication? And it is example nitroglycerin taken for chest pain. Sublingual medications, the answer says it dissolves quickly. It absorbs quickly into the bloodstream. How do you administer your sublingual medications? Ask the patients to lift the tongue to the roof. Place the medications under the tongue on the floor of the mouth. Sublingual is placed under the tongue. Next question. You are palpating for pulse on an unconscious patient. Which pulse would you palpate? The correct answer is the carotid pulse. The carotid pulse. Next question. Your patient's urine is orange. What do? Normal urine is yellow clear straw color. This urine is yellow. What do? The correct answer is check your medication list and see if Pyridium was administered to your patients. Pyridium If the urine is orange, this would be an expected findings. It would be a harmless symptom. What is normal urine color is the question. It's clear, straw color, pale yellow. It is odorless, not foul smelling. Foul smelling is presence of bacteria. We'll send that urine to the lab to check for presence of bacteria. Next question, unconscious patient suspected of neck injury. When we're doing CPR, what would we do is the question. The correct answer is the jaw thrust method to open the airway on an unconscious patient suspected of neck injury. What do you know about axillary temperature in comparison to oral temperature? The correct answer, axillary temperature, is 1 degree lower than oral temperature. What do you know about tympanic thermometer is your next question. Tympanic thermometer measures core temperature that are internal structures of the body, deep structure. What do you know about latex allergy is the next question. What do you know about latex allergy? Latex allergy patients are at risk for anaphylactic reactions. Examples of anaphylactic reactions: wheezing, shortness of breath, difficulty breathing. Notify the doctor stat. This is an emergency. Clients with latex allergy will place latex-free gloves and Foley catheter in the room. They should use only latex-free supplies. There is a latex-free cart that we stock in the rooms, and we always put a latex allergy signs at the door. So when the respiratory therapist comes in, the speech therapist comes in, the physical therapist comes in, occupational therapists, they'll all use the latex-free gloves on the cart in the room. When we are administering Foley catheter, what kind of gloves does the nurse use? And the answer is sterile gloves. Elderly are at risk for urinary tract infection. First sign of urinary tract infection in the elderly is confusion. The patient was oriented times 3 yesterday, and today the patient is confused, oriented times 1. Notify the doctor, send the urine to the lab. We need to check for bacteria for urinary tract infection. When you restrain a patient, how often should you do your documentation? The correct answer is every 2 hours. How long does the restraint order last? Every 24 hours. You have to get a new restraint. We have to reassess the needs of the patient. If the patient has restraint on and you loosen it, you have to exercise the fingers, toes, and assist them with their circulation. And we would assess them. If they're no longer confused, then we can discontinue but we have to assess them. We can discontinue their restraint order, but restraint order, new one every 24 hours, documentation and assessments of your patients every 2 hours. When do we use restrain is the question. We use it when all other alternatives, methods have attempted and failed. We have the bed alarms up. We have the 3 side rails up. The patient is still jumping out of bed. We cannot put up 4 side rails. then we'd ask the doctor for a restraint order. We medicated the patient. It did not work. We tried everything. When everything attempted have failed, then we order the restraint. It's not for the nurse's convenience. Next question. What are your assessments for restraint? The correct answer: you assess their fingers for blueness, circulation, exercise the fingers. We ambulate the patient. We assist them to go and empty their bladder in the bathroom. And we offer fluids to the patient in restraint to prevent them from dehydration, especially those confused elderly. We want them to be dehydrated. When we admit patients, maybe in the emergency room or first on the floor, we assess them for burns. What else do we assess the elderly for when they're admitted? Signs and symptoms of cigarette burns these patients have. We'll assess them. We'll assess for signs and symptoms of cigarette burns, elderly abuse, female abuses. The answer is we'll assess for bruises, wails, cuts, unexplained cuts, unexplained wails, unexplained bruises in the elderly on the children. Sometimes when the elderlies are with the families and you just admit them and you suspect signs of abuse, cigarette burns, elderly abuse, children abuse, you'll ask the families to step outside, and for privacy you pull the drape and see if you can get some questions answered privately from the patient concerning abuse at home. Some elderlies are abused at home. The family tried to just get their money, maybe their social security on a monthly basis, and they abuse them. They don't care about them. So we have to let the family step outside of the drapes and question these families, female abuses, husbands, get them out of the room, boyfriends, get them out of the room, and we assess for abuse. For children, nurses report to child protection, nurses report elderly abuse. Okay. Next question. What is community rate assessment? What is community rate assessment? The correct answer: RN collecting data to determine how many, for example, how many adolescents have attempted suicide in the community. Is an example of community rate assessment. Community rate assessment: how many chicken poxes in the community? How many measles are reported in the community? How many lead poisonings are reported in the community? This is community rate assessment in the community. Please note that the community nurse is initiating lead screening in the community. The nurse, the community nurse, is initiating a lead screening program. This activity is based on, and the answer is, it is based on lead screening program. The correct answer is social determinants of health, which is physical environment. Please hit the like button. Please subscribe. Please share this video. Stay tuned to part 5 of exam 2 coming up shortly. Thank you. Have a good day.